Not all physical therapy offices are the same, and that's especially when you're treating neuropathy.
Right. When we treat somebody who has neuropathy, we look at the entire person, not just the neuropathy. So we're looking at mechanical structures, we're looking at posture, we're looking at balance between muscles and soft tissues that can affect irritation of the nerve, also mobility of the foot and the lower extremity.
And traditional physical therapy usually just focuses on the muscles and the joints. And they are important, but for chemo-induced neuropathy, we also have to think about the nervous system.
We build a customized plan when we figure out what we think is the most important contribution to that peripheral neuropathy. Yes, there's damage to the nerves, but as we were saying, that there might be other factors. So our plan is manual therapy if necessary to mobilize soft tissues and joints where necessary, therapeutic exercise, balance training. We need to retrain your balance, especially when you have peripheral neuropathy, because those nerves are desensitized and or damaged because of the chemo. We also use some interesting devices, very high-tech devices, including the StimPod 460, which is a form of
Neuromodulation.
Exactly.
And then there is the CareWear, which is the photobiomodulation.
At least we know how to say those. So those two instruments help us, in addition to our other comprehensive treatment approaches, to help people with peripheral neuropathy. And we can speak from personal experience because I have some chemo-induced peripheral neuropathy and use both devices and can report that it has significantly reduced my peripheral neuropathy. I used to feel like I always had sandy bubble wrap in my shoes. And although I feel it intermittently, I can't tell you why, some days versus other. On the whole, it's dramatically reduced. I'd say about 70%. I've been using both devices for 2 months regularly.
So the more that we understand about your specific situation and what's going on in your body, then the better we are able to develop that individualized treatment plan. So if you're looking for a more comprehensive approach to deal with your chemo-induced neuropathy, we're the place to call in order for us to be able to provide you with that customized plan to help you be able to walk better, move better, and get back to doing the things that you love to do without that weird bubble wrap feeling. Cheers.
Cheers.
Here's to another Wine Wednesday.